Good morning. This is Peyton Garner. I'm going to be presenting on some of the main structures of the human eye and a few different common disease processes. I'll be discussing cataracts, glaucoma, and age-related macular degeneration. We'll go ahead and start with the structures of the eye.
Okay, so here are my main structures of the eye that we're going to go over today. First, I have the sclera, which is considered the white of the eye, which is going to provide protection for the eye and allow for different functions of the eye to work properly. Here I have the lens, which is the green portion here. The lens is going to focus the light of that the pupil takes in, which is held in place actually by these suspensory ligaments. This helps give the eye lens to move. Next, I have the iris, which is this structure here and here. The iris is going to contain the pigment that gives the eye color, and it also helps to adjust the eye for brightness. So as brightness is more prominent, the iris of the eye will get a little bit smaller and adjust for those issues. Here I have the cornea. The cornea is that blue structure, which is the outer covering of the eye that also protects the eye. Then I have this small structure here, but very useful, the pupil. The pupil is the black dot in the middle of the eye, which is the hole that allows the light to take place or to work through. So the hole here in the pupil reflects light into the eye, allowing us to see. Next, I have the anterior chamber or the aqueous humor. This is the watery substance in the eye that's going to help the eye to maintain its shape. It also helps protect the eye in some of the structures. Next, I have the orbital muscles here. The orbital muscles help the eye to move side to side, up and down, give us movement in that eye so that we're not a stationary structure. Here I have, I already talked about the suspensory ligaments that helps the lens move and stay in place, things like that. Next, I have the vitreous chamber, or the vitreous humor, which is this portion of the eye here. This is the gel located in the back portion of the eye that's going to help the eye keep its shape. So that part's really important. Next, I have the optic nerve, which is this yellow portion in the back. The optic nerve helps us focus light through the retina. It also sends the chemical information from the eye to the brain and central nervous system, which helps us to see. So this is a very important structure, and we'll get into this structure a little bit more moving forward. Next, I have the fovea, or the macula, which is one of the most important portions of the eye. This is the functional center of the retina. This helps give us sharp central vision, which will come into play as we move through some of the disease processes. Next, I have the choroid, which is between the retina and the sclera, which provides blood supply to the eye. We all know that the body needs a blood supply to keep things moving and functioning correctly. And then I have finally here the retina, which is where the light is transmitted. Rods and cones are in this area here. It's the yellow area around the eye. Rods and cones are in there, which helps transmit light as a chemical signal, giving us the ability to see. So this is my sagittal view of the eye, and we'll get into some of these structures as I talk about some of the disease processes. So let's talk about one of the diseases of the eye. It's actually very common. It's actually called a cataract. Which is the blurry vision that you can have over the age of 40. So the vision starts to break down. This is actually a problem with the lens of the eye here, so this green structure. So around age 40, the proteins in the lens of the eye start to clump together, and they leave a lead to cloudy vision here on the lens. So that's important to know as you get older. So how to diagnose this issue? The physician's going to go ahead and dilate the pupils in a dilated eye exam. So they're going to dilate that black structure there so they can see into the optic nerve and the retina, and that can help us to decide if the lens is having issues with the protein buildup.
So with cataract, you may have issues reading or doing like daily activities. So the nurse can come in and talk to them about some of the treatment options, which will include surgery. So oftentimes the cataract, there's no other really treatment options other than surgery. But some things you can do to prevent this issue would be to wear sunglasses or a large brim hat that help you cover your eyes from the sun. You can quit smoking, have a healthier lifestyle with eating and maintaining exercise, and then obviously getting a dilated eye exam. Some other risk factors could be controlling diabetes. You don't obviously want to quit. You don't want to smoke, so we'll have you quit smoking. And then if you have a family history of cataracts, it's going to be important for the nurse to reiterate having those eye exams. So that way you can prevent this issue from causing permanent damage.
My next eye disease that I want to talk to you about is glaucoma. So glaucoma is actually the loss of peripheral vision or blindness to the eye, which has to do with the optic nerve here in the back of the eye. So the eye disease, it's an intense pressure to the eye that can actually damage this nerve back here, causing vision loss and blindness. So we'll go ahead and discuss glaucoma. There are a few different types of glaucoma, and that has to do with called something open angle and closed angle glaucoma. It basically has to do with the relationship between the iris and the cornea. So in this structure here being an open angle and this structure here being a closed angle.
So again, with glaucoma, it's going to be a loss of the peripheral vision of the eye. It usually is treated with surgery. There are some medications or injections that you can get, but usually a laser surgery is what's needed at this point. Again, the doctor's going to go ahead and dilate that eye with the comprehensive dilation exam to look into the pupil to see damage to the optic nerve. So here, the nurse can talk to the patient about taking medications as scheduled for their glaucoma. They also can talk about the family history of glaucoma. If you have that, go ahead and get in and get your eye exams done. If you're having trouble focusing, which is a lot of the issues too, about some of the things that you're missing on the peripheral vision, go ahead and get in to see the physician to get that taken care of, because there is no cure for the glaucoma other than the treatment with drop therapy or laser. You can also educate the patient about having other family members get tested for glaucoma because it is a hereditary problem. Encouraging family members to go get treatment and get checked out will also be helpful.
And finally, we have age-related macular degeneration. So this is a disease of the eye that usually happens over the age of 50 or 60. It's an issue with the macula in the back of the eye. This can blur the central vision that we need to see things like reading right in front of us, faces, driving, things like that. It tends to blur the central portion of our vision, which again can be seen through a dilated eye exam.
So with age-related macular degeneration, the physician can order the dilated eye exam that we talked about earlier, or they can order something called an optical coherence tomogram, which basically lets them see the back of your eye in a different way. Treatment for this age-related macular degeneration is often surgery. So they'll have to get the LASIK surgery. There's eye drops they can take. But this is a really big problem for the central vision issue that we're having. So things like reading become harder, cooking, things like that. The nurse can go ahead and let the patient know about some risk factors. If you're Caucasian, over the age of 50, you have a history of age-related macular degeneration in your family, or if you smoke. So the nurse is going to want to educate about some of the controllable risk factors as far as smoking, getting regular exercise, healthy blood pressures, maintaining diabetic levels and blood A1C levels. But they also want to include a healthy diet in this situation as well. So age-related macular degeneration is, you can't really avoid it. If you're going to have it, you're going to have it. But controlling some risk factors are going to be helpful for this. Again, that's the central vision loss, what you see straight ahead. So that trying to move things away from you and things like that can be one of the signs and symptoms of age-related macular degeneration. So these are my 3 different diseases I just chose to talk about for disease of the eye, and I hope this video was helpful. Thank you.